conversation and a surgeon, of course. I'm not allowed to have favorites, but I often live out of the Amelia Wilmington location with Dr. Azzolini, who is generously spent some time giving us some answers today when we talk about all things post weight loss and plastic surgery. So thank you very much. We're happy that you're here.
Thank you for having me. I've watched a lot of your lives from before I joined Amelia, so it's kind of surreal that now I'm here doing one of the lives, which is awesome. When I
I
first
don't know.
met you, I thought you were like a celebrity. I felt like I was meeting somebody famous. So now here I am with you doing a live. It's great.
I'm just a talking head. Well, I think we're only 2 hours apart from each other in Raleigh or Wilmington, so we are both
Hmm.
having that same weather. You can see that Dr.
Yeah,
Azzolini is having. So
yeah.
apologies in advance if we have some technical difficulties, but hopefully it'll be okay.
Hmm.
Because this is so important. I think losing
Yeah.
a large amount of weight is so extraordinary. It's actually what brought me into this entire industry. At 21 years old, my sister lost 100 pounds and decided to have a lift with implants. And I was blown away, first of all, that normal people did that, and that it made such a difference in her life so quickly that I literally found this job in the paper that week and started. So it's because of these surgeries we're going to talk about. They're some of my favorite patients. You've done
Yeah.
all of this work, and you've changed your life and every piece of your life, and then you're left with something you cannot do anything about, usually
Hmm.
excess skin and loose
Hmm.
muscles. So we're going to talk about that as much as we can today, but
Yeah.
because there are so many different combinations and everybody is unique, it's hard to be super prescriptive.
Yeah.
But I mean, I got to be down there and film one of your amazing weight loss transformations. That's why
Oh,
I
yeah.
kept seeing Jimmy's video on your Instagram today.
Yeah, and you say you can't pick favorites in terms of surgeons. I probably shouldn't pick favorites either in terms of patients, but I can say for sure that my massive weight loss patients are always some of my favorite. They're like you said, they put in all this work, right? And they whether it's and in the advent of GLP-1s and things, people are losing weight. They're getting healthy. Um, and maybe they look great in clothes, but they know, like, when they go home and they look in front of the mirror standing there nude, they know there's another story under the clothes. And it's something that is so unfortunate because you do make that choice to better yourself and to lose the weight, and then you're left with all this extra skin.
Mhm.
And it can be anywhere. And so these people, they've already put in the work. They're usually some of the most kind people, and they're so grateful for what you can do for them. I really enjoy doing these types of surgeries, and that's why I was excited to have this as the topic for the live.
Yeah, me too. If
Hmm.
someone were to ask you kind of on the street, like, where do you want to see someone in their weight loss journey,
Hmm.
timeline wise? Because I know a
Yeah,
lot of people are like, well, when I get to my goal weight, or what, and
yeah,
does anyone ever get to their goal weight? I mean, I know some
yeah.
people do, but it's, it, or do I have to have kept at a stable weight for 1 year? I've heard that
Hmm.
before. What do you say to
Hmm.
someone?
I don't think there's a prescribed time in order to get information. The way I look at a consult that I have with somebody, it's a big information session, right? Just because you're having a consult with me doesn't mean, yeah, I would love for you to book surgery, but it doesn't mean that you are at the point where you're ready. Plenty of people are coming and see a consult and they're like, well, I'd like to wait till after summer. So
Hmm.
you can come in for a consult because then you get to the information about what the surgery entails, what the risks are, maybe where we would start.
Hmm.
And why, and kind of pick and choose what's important to you. And that doesn't mean that you have to be at your goal yet. But I will say that it's very common for surgeons, including myself, to say we want your weight to be stable. If you're going to undergo a big surgery that can be expensive, and we want the result to be as good as possible. And so weight stability, meaning that we know that you can maintain this weight without too much weight gain back. That's what the time is. When you want to wait 6 months, it's to say, okay, I know you're good now. You're not going to, like, you didn't hit the bottom and you're going to spring back up, because that can really affect the results. That doesn't mean you have to wait till then to see your consult. If you're in the process of losing weight and you want to get more information about it, schedule a consult, and then then you have an idea of what you're getting yourself into.
Yeah.
If you are somebody that's losing massive amounts of weight, 80, 100, 200 pounds, I mean, this is going to be in your future. And so whenever you feel the time's right to just sit down, get some information, I'm happy to do that at any time, even if it doesn't necessarily mean you're ready for surgery today.
I feel like that would be so motivating too, but also budgeting. And I can direct you to some pricing stuff, because that is a piece of this. You know, we all kind of know breast augmentation costs about this much, but this can be, I mean, depending on how many procedures you want to have, arms and thighs and breasts and stomach and back even, it can be expensive and something to plan on, which we like to give people the heads up on that. No surprises. That unfortunately you're in for it when it comes to this surgery.
Yeah. It's never one surgery, you know, for people that have lost a lot of weight. It's never one. And you're exactly right. I mean, these things can add up. And so to the extent that it fits in your life and your budget, that's why I say, you know, and I'm sure we'll touch on this, but when it's like, okay, where do I start? There's no rule. There's some suggestions, but there's not a rule book that says you have to start here. My question back is, well, what bothers you the most? Let's see if we can start there. You know, because it is something that I would say, get the thing that bothers you the most. There's two things. Get the thing that bothers you the most done first, or just get the tummy tuck out of the way first, because that's the most painful one. You know, so you knock that out. So it's, you know, the other recoveries compared to that are pretty much a breeze. So,
well, because you brought up GLP-1s and then even keep maintaining a stable weight. And I'm only saying this too because I've heard the questions, but this is something even one of your patients said to me, oh my God, I have to go off my GLP-1 during surgery for X amount of time, which then is like, oh my gosh, well, I gain weight back. Can you talk to us just really, because that is such a common question these days. How long does somebody have to be off of it? Any recommendations for not gaining weight during that season?
Yeah, so we recommend that if you're getting a tummy tuck, we recommend 2 weeks off before and 2 weeks off after. And if for other smaller surgeries like a breast lift or something, usually it's 1 week off before and 1 week off after. And so, you know, you're off, the window of time where you're off of it is pretty short. And when we say we don't want weight fluctuation before or after surgery, we're talking, we don't want you to gain or lose 20 to 30 pounds or more in either direction after surgery. And so you're not going to do that in the 2 weeks before, 2 weeks after that you have to be off of it. That would take a lot of work to try and gain 30 pounds in 2 weeks, you know? So I would say the window of time that you're off of it is not really going to make you gain that weight. And also the reason that you have to be off of it is extremely important. It's a non-negotiable, essentially, because what happens when you take the GLP-1s is you have delayed gastric emptying, meaning your stomach just doesn't empty as much. And now when you're under anesthesia and you're laying all the way back flat and your stomach is not fully emptied because you've been on these medicines and this kind of just paralyzed them in a way, what can happen is you could throw up. And if you throw up while you're asleep with your head lying back, the vomit can get into your lungs and you can get pneumonia. And that's a hospital stay. That's, you know, that's not something that we want to risk, especially when we're undergoing something like elective surgery. You know, this is not surgery to save your life. And so that would be something that we'd have to be strict on in terms of being off of it. Now, if you go to the hospital and you need life-saving surgery, they're not going to be like, well, let's wait 2 weeks, you know, but that's extenuating circumstances. We as plastic surgeons have the luxury of making the environment when you have surgery as safe as possible. And that's our job.
That 4 weeks, that sounds worth making sure we don't take that. Let me ask you about kind of the staged approach. As in, some people do the tummy tuck first, like you said. A lot of people end up doing their arms and a lift. You know, everybody's weight affects them differently, even back lifts and thigh lifts. How do you guys decide which ones to do at which time? And is it the patient's choice? Is it time, pain, recovery? Like, what if I want to do it all at one time?
Yeah. And so That's a great question. I mean, and the answer is it's a collaboration. I'm willing to work with the patients again to say, hey, what bothers you the most? Okay. And usually with all of these operations, I like to combine two of them at a time. I would say once you start adding in more, you're putting yourself at risk for getting too much surgery. Also, in most surgical centers, including ours, there's a time cap on how long you could do surgery in a setting like this at 6 hours. And so, that's one of the constraints. But the other thing is you have to heal. And these are, no matter what surgery it is, these are big, long incisions. And you got to give your body the best chance to heal. And so doing too much too quickly, I would be worried that you'd be at risk of wound healing compromise. Some of the things I look at, so I like combining upper with upper, lower with lower. So if I had my choice, I would do arms and breasts, and then at the next stage, maybe thighs and tummy. And then there's more to go. I mean, sometimes, hey, what about the back? What about the 360 tummy? Would I do that first? And I would say, yeah, there's things also that I would say, let's try to avoid combining those. And those would be things, there's a concept in plastic surgery of opposing vectors. All that means is you're pulling the skin in two different directions. You don't want to do that, right? So if you're doing, a bra line back lift, where your incisions are like that, and a lower, I'm drawing a picture here, and a lower back lift, so this is your body essentially. Okay, let's say this is somebody's back, right? And this is the upper bra line back lift. You making it 2 incisions and then you close them. And then the lower, you make an incision kind of like an M to kind of cup the buttock, and you pull those closed. Now, what opposing vectors means is this skin is getting pulled down and this skin is getting pulled up.
Move it to your right a little bit. There you go.
Way? There we go. Okay.
There you go.
This way. Okay.
Yeah.
So this skin is getting pulled down and this skin's getting pulled up, and they're pulling against one another. And so, whenever you have opposing forces, you're at risk of putting more tension on those wounds. That's just something we like to avoid. So I would say if your plan for surgery is including the back, I would say, it would be better to combine the bra line back lift with maybe the breast and then the 360 tummy and do those at separate times. Let the upper portion heal and then do the lower portion, rather than do, some people may say, well, hey, why don't I just flip on my belly only one time? You just do both.
Yeah.
I don't like those opposing forces. So I would request not to do that. But, for the most part, I'm willing to work with my patients and kind of see what's bothering the most. And if we can make it happen, I'll make it happen.
How long, say I'm planning out my stages, how long between each surgery would I need to wait?
Usually we like to give I want you to be like totally healed. Usually we say that's 6 months. I would say if you're healed really well, I usually see my patients back 1 week, 6 weeks, 4 months, and 6 months. If you come back at that 4-month visit and things are looking great and you're healed and there's no issues, what I've been doing is turning that 4-month visit into the pre-op visit for their next surgery. So it's a follow-up and also a pre-op for their next stage. And so I'm willing to do it a little earlier than that 6-month mark, provided everything's healing really well. But, generic answer for plastic surgery, give yourself 6 months to heal and then move on to the next one. Yeah.
Planning wise, financially too, all of our prices are listed, or all of your prices are listed at askamelia.com. It's not perfect because it's like you're adding things to your cart, and you offer multi-procedure discounts. So, but we did our best to give a range at least. So I do always point people, the prices are all on there for arm lifts, thigh lifts, tummy tucks. So just in case somebody is mentally totaling all of this down.
Okay, good.
I'm
glad you didn't ask me how much something cost.
I know,
because,
exactly.
I was not going to know the answer. I'd be like, that's a question for Denise.
I don't remember anymore
but
either.
Yeah, I do know that all the prices are on the website. So.
Yep. Can you walk us through really quickly what are the major the major surgeries when it comes to post weight loss? Because I do think people don't know as much about arm lifts and thigh lifts specifically, but you mentioned like, hey, these are all large incisions. Can you kind of do a little show me what each one does and recovery and pain level maybe for them?
Yeah. So the arm lift is essentially an incision from the elbow. You typically don't want to cross the elbow, the joint. That's not
Mhm.
usually good for healing. And when usually, I mean, most people don't have loose skin in their forearms. It's the loose skin under the arm here.
Mhm.
Okay. And so you make an incision from here that goes up the back of the arm. Sometimes it's like, if you're wearing a strapless shirt, sometimes it's directly down the middle. I try
Mhm.
and move mine in a little bit more so that when you're wearing a sleeveless shirt, we're in a beach town. You don't want somebody walking the loop over Wrightsville behind you, just staring at your incision. So I try and move it in a little bit, and I hide it kind of right in here. So in my before and afters, and when they're doing their arm up like this, sometimes you can see it, and I do like that the before and afters where you can't see any incision at all. It looks like it was like just magically done
Magic.
because there's
Yeah.
no incision. Um, but I'm okay with seeing a little bit of incision if it means that when your arms are down, nobody can see anything in the back, and really nobody's going to see it here. It's kind of right along the front bottom of your arm there. And then, so that's a standard, you go from here to the armpit. The extended would be, let's say we carry that down, right along the side of the chest. A lot of people have extra skin under their arms, and it can be removed one of two ways. This is one where the arm incision extends down and it kind of goes down like this, and you have a vertical scar like this. The other way is with a breast lift scar that gets carried out to the side here. And so
Mhm.
almost like an extended sort of breast lift. Now I like to do vertical patterns where it's just the lollipop.
Mhm.
Um, but in somebody that has a lot of extra skin and they want that skin removed, it's usually a good idea to do a little anchor or a L or J and carry that incision out to the side. And sometimes it's both. So we mentioned arms
Right.
and breast. It's a great
Mhm.
operation to do together because then you take that incision, it goes around the armpit, down. So you remove skin in this dimension vertically, and then you have it carried this way. So you remove skin in this
Wow.
dimension.
Yeah.
And so if we're talking armpit skin, that's probably the best way to get all of that skin as trim as possible. And then even then, you may still have to go around the bra line, to the back. So
Uh-huh.
that's the scar for the arm lift. Now the
Okay.
breast, what would you add? Oh, the thighs.
Yeah. Well,
Okay.
all that help. That's a brachioplasty, an arm
Yeah.
lift. To
Hmm.
either usually I think most people post weight loss. Like my sister got a lift, but then
Hmm.
also got implants. And I think a lot of people are like, wait, I
Yeah.
lost weight. Do I get implants? But it
Yeah.
was really for the shape. So I think reductions, lifts, and implants.
Hmm.
Can you do a reduction and implants at the same
Yeah.
time?
Isn't that so? It seems so counterintuitive, but
Yeah.
yeah, I mean, it's very common to do a reduction. I would say it's more common you get somebody that has had a reduction already, and then they're like, well, hey, now my breast looks like a ramp or something. It's really
Mhm.
flat up top, and all the fullness tends to be low. And so, yes, an implant for shape is a great idea in people that have lost weight or they get a breast reduction. It seems so counterintuitive. Like, do you want your breast to be smaller or bigger?
Mhm.
Make up your mind. But in reality, it's no. It's you want them to be less heavy. You don't want them down here where it's kind of weighing you forward. You get them up and lifted, and then you add an implant for shape. And when you're doing that, if you're doing say you're doing a reduction, the person doesn't need volume, right? The implant can add volume and it can also add shape. And so in those patients, I choose a flatter implant. So like everybody thinks high profile, to get the upper pole fullness. That's exactly it backwards. I was arguing with my wife about this the other day, actually.
Mhm.
She's like, get high profile. I was like, actually, no, like high profile is not really. Anyway, but so a flatter implant, somebody that has a bunch of breast tissue, they don't need a high profile, high projection implant. What they need is a wide they're round. So if they're wide, they're also tall. So they need something that goes up and gives them that shape. Their breast volume's down here. They don't have anything here. And so that flatter implant just gives them, it's like a platform for the breast to sit on. And then it peaks up over top and gives them that nice round fullness up top. That goes for a lift or a reduction. People that just want shape, there are great implant choices for you that don't add a ton of, size essentially.
Mhm. Got it.
Yeah.
Okay, moving down the body then, tummy
Let's move
tucks,
down the
the
body.
main
Okay.
one, because there are people, the FDL,
Hmm.
Fleur de Lis tummy
Yeah.
tuck.
Yeah.
extended, circumferential, a
Hmm.
lot of times that is where somebody carried a majority, I guess, of their weight. And so they lose their weight. It's very deflated. A lot of high up loose skin too, stretch
Hmm.
marks. Belly button we got a lot of questions about belly button, reverse tummy tucks, and all of those things. So yeah,
Yeah.
can you kind of walk us through how you decide with a patient
Hmm.
which one is needed,
Hmm.
for which kind of, I guess, body style?
Yeah. Yeah. It's a good question. I would say almost everybody that comes in, like, that has massive weight loss, you start with, they're going to at least need extended, right? So we start there because what extended means is if the normal incision is from hip to hip, hip bone to hip bone, it's, maybe this long. We know that when you lost all that weight, that excess carries around. And so at the very minimum, the weight loss, massive weight loss people, you're going to have at least an extended, which just means the incision is longer and it starts to go around the bottom of the body. There's limitations because you can only go if you're laying on your back, eventually you hit a table. So you
Mhm.
can't keep going, but you can go pretty far around. So that would be the extended. Now, the next step is, do we need a fleur de lis? I would say you look at somebody's pattern of excess skin, and there's plastic surgeons will say horizontal excess or vertical excess, right? What that means is, how is the skin kind of hanging? Is it hanging down off a lot of people have a pannus, right? Where the skin's just hanging down here, right? That would be one pattern of excess that usually you can remove by taking out skin this way. But so vertical excess would be, imagine like a curtain on a window that's kind of pushed to the side and closed. The folds that are in the window
Mhm.
curtains. Some
Mhm.
people have that pattern of excess, and if you just try and pull that down, that's not going to essentially
Yeah.
smooth out those pleats, right? And so in those patients, you have to ask the question: do we consider a fleur de lis? A fleur de lis means you're taking it out in two dimensions. You're taking it out at the bottom, and I'll draw it again. I draw
Nice draw.
everything. It helps me um, when I'm
Well, we
learning
like it too.
things, and so
Yeah,
yeah.
I think surgeons are better drawers than you guys are with handwriting and penmanship. So please draw.
Well, I'm not a great drawer. I will admit that, but I get by. And the other thing is, I've gotten pretty good at drawing upside down. So the fleur de lis pattern excision looks something like this, right?
Mhm.
And so when you close that, it kind of looks like the anchor pattern breast. Right.
Move it the other way again. There you go. There you go.
There we go. Okay.
Yeah.
So when you close that, you have the incision up and down, right down the middle of the abdomen, and then the side to side, which is
Got
usually
it.
also extended. So in people that have lost massive, massive amount of weights and they have that pattern of excess, you have to at least consider the fleur de lis. Now, again, I keep referencing we're in a beach town. I can do the best I can with an extended to make you not have to have that up and down, scar, because
Mhm.
people like to go to the beach and nobody wants a scar like that. But
Mhm.
if your primary goal is just, hey, make me like, I want to look good in clothes, like I don't mind the scar, just make me look as trim as possible. That's when you consider that, is when you have a pattern of excess that requires you to close the skin this way instead of this way.
Mhm.
Um,
Do those
and
still
you
include? Oh, sorry. Go ahead.
No, and then the last thing I was going to say is the reverse tummy. You mentioned the
Yeah, yeah.
reverse tummy.
Yes.
That's where, instead of pulling the skin down, you take this skin and pull it up. Um, I almost never start there. I would say it's very rare when somebody just needs a reverse tummy tuck. A case would be like, let's say somebody's is really flat and thin below the belly button and all their extra stuff is above. It might make sense in the right person to just take out the skin up here and pull everything up to flatten it instead of pulling
Mhm.
it down. Where I see more value is, let's say you've already done a fleur de lis and somebody that's lost a lot of weight and they just have a little bit extra still up here,
Mhm.
and you've already, the belly button looks good. The bottom of their belly's flat. The next step then, in my mind, would be, let's do the reverse tummy. And then you essentially make a capital I, so you have an up and down, you have a side to side here and a side to side at the bottom.
Mm,
So that's when I think the reverse is most useful.
mhm.
Yeah.
Um, do all of these tummy tucks also include liposuction and muscle repair? Like, is that a piece of it even for weight loss patients? If it's not like a mommy makeover, do they still need muscle tightening?
Yeah, I mean, I think it helps with the shape. I think the muscle tightening aspect of the surgery is twofold. It helps with functionality, and mainly people that have had muscle separation. So women that have had pregnancies are a great example of people that have had separation. I've seen some separation, muscle separation in people that have lost a ton of weight because they still also, like a pregnancy, have really stretched out that intra-abdominal fat, the fat that's inside around your organs. Just like a baby kind of pushes up against the muscles and stretches things out, that also can happen. And so, yeah, I think it's worth it to repair that muscle in even a massive weight loss patient, even if they don't have, let's say, the degree of separation that's caused by pregnancy. Like men, for example, that get this operation, they still have a gap usually. And so it does help functionality. And it also just aesthetically, it brings everything in on the inside. So it just kind of trims the waist a little bit. And so I would do it. I do that standard for everybody. I can't really envision a scenario where it wouldn't tighten up the muscle in some way.
No, it's the best
Yeah.
part of my tummy tuck.
Yeah.
But I asked because I'm leading you into paniculectomy because I
Oh,
get
yeah.
that question all the time of
Hmm.
like, and it literally, I know someone who recently said, you know what, no, I'm just going to go the paniculectomy route. My
Hmm.
insurance is paying for it.
Hmm.
She's about 3 months out and is messaging me like, I've made a mistake.
Yeah.
Now, how do I need to have, I guess, a regular tummy tuck? And we're
Hmm.
trying to figure out how to help. But yeah, she has no belly button, had no muscle repair.
Oh,
Um, it seems good, I guess, in theory, but can you explain what a paniculectomy is and the
yeah.
insurance versus not piece?
Yeah, a paniculectomy. I mean, I don't want to bash the paniculectomy. It's not an aesthetic operation. It's not meant to make you look good, essentially.
Mm-hmm.
The reason insurance covers a paniculectomy is because it's usually associated with other symptoms like rashes or yeast infections. What a pannus is just that fold of skin that hangs down, and so you could essentially lift it up like an apron. And underneath there, people get infections, they get raw skin, they get wounds. Um, Another maybe less known reason to get a paniculectomy is if you need a kidney transplant. That's another reason why it would be covered by insurance because you need to have, somewhere to put that, a place to put that kidney, and a
Mm-hmm.
pannus,
Oh,
interferes
wow.
with that. And so there are plenty of reasons to do a paniculectomy. It's not that it's a bad operation, but
Mm-hmm.
it's not. Don't go into getting a paniculectomy thinking you're getting a tummy tuck. It's
Mm-hmm.
not meant to make you look like you had a tummy tuck. It's just simply removing the skin that's overhanging, and that's it. So when we do a tummy tuck, I mean, we're taking more than just what's overhanging. We're taking a lot more, and we have to sit you up because we're pulling your skin so tight. We reposition the belly button, we repair the muscle. All of these things come with a tummy tuck. A paniculectomy is just simply removing that sliver of skin that's causing the problem and
Mm-hmm.
stitching you up. And so all the other problems, if you have excess up at the top of your belly, if your belly button's kind of droopy and sad looking, none of that gets fixed with a paniculectomy. Now, it's covered by insurance. And so if you've lost a bunch of weight and you're like, hey, I don't need that whole thing, I'm sure it's a much easier recovery too than a full tummy tuck. And so you don't need all that, and you want to go the insurance route, that's an avenue to help treat your symptoms. But don't think of it as an aesthetic operation. Think of it more of a symptom management operation.
Mm-hmm. Got it.
Yeah.
Okay, continuing to move down the body. Let's
Hmm.
talk about like lower body lifts, thigh lifts.
Yeah.
Where is the ins I get a lot of thigh lift questions,
Yeah.
and I don't know a ton. I know there's different ways you can do it with the
Hmm.
incisions in the groin and things like
Hmm.
that. But yeah, what is a thigh lift and lower body lift?
Yeah, so a thigh lift is essentially just like every other lift. You're removing the extra skin on the thigh after weight loss. And what I like to do, you're right. There's multiple ways to do it. Sometimes you combine those two ways. But whenever somebody's coming in and they want what a lot of people will do when they want something, let's say they want a facelift, they'll go like this. I just want to look like this, right? And they'll do something with their hands. They'll kind of pull. I just want to look like this. Well, when thigh lift patients come in, it's almost like, I don't know how diagnostic this test is, but I feel like it's really reliable. They'll do one of two things. They'll come into your office and they'll lift and they'll go, I just want my thighs to look like this. And they'll lift up like that.
Uh-huh.
Or they'll take their skin like this. I just want it to look like this, and they'll pull it around like that, right? Going back to our conversation on patterns of excess, those are two different vectors. One is removing skin circumferentially around the thigh, and one is literally lifting the thigh upwards, right? And so sometimes people only need one or the other. So there's a version of the thigh lift where the incision just goes right in the groin, kind of from the inner thigh out. That's called a medial thigh lift. Sometimes you even start on the belly, and people that have excess on the back of their thigh too. And you could remove the excess on the back of the thigh, and then you flip over and do the front medial thigh lift. The other version is when you take the skin out or circumferentially, and you have an incision essentially up and down from the knee to the groin, kind of analogous to the elbow to the armpit kind of thing, right? And so those are the two patterns of thigh lift. Now you can combine them if people have a lot of excess. Very commonly, you have to do like a hockey stick pattern where you have the incision going up and down the leg and then kind of carried over like this, right, on either side. So the incision looks like that on either leg. So this is going up and down, and then this would be like the groin incision. And then, we're talking combo operations, right? A lot of times the tummy tuck scar is right there. And so you kind of can meet it to the tummy tuck scar, which is usually coming right across here anyway. And again, this is why I think this is a good operation if you're going to combine some, I would say tummy and thighs is a good way to combine, just like arms and breasts is a good one to combine.
What is the recovery? I know you already said the tummy tuck is the toughest. So a lot of times people can do that first, but that thigh lift one sounds like a doozy too. But what do most people say? I know you've got some great arm lift before and afters on your Instagram. So how are their recoveries?
So everything's different. I would say the tummy tuck is the hardest in terms of pain, in terms of, kind of needing to be off of work and things like that. I mean, a tummy tuck, like I said, we pull you really tight. And so you're kind of hunched over when you're walking. The muscle repair causes really intense, deep soreness, like you've done a million sit-ups. And then the lipo, which is included in all of these operations. We do some degree of lipo. That has its own set of sensations and pains. And I'm still every day, I'm getting different descriptions of what the pain is like, but the common things are like itching, burning, numbness. Some people just say sore. And then with the muscle repair, really deep soreness, not like sharp pains, but just a deep soreness. And so that first few days of recovery after a tummy tuck, especially, I like somebody to be there with my patient, kind of that's going to be taking care of them, helping them get in and out of bed. This is it's a very new thing for your body. You've just undergone essentially a big trauma, stressful event on your body, and so I don't want you getting up and then getting dizzy and falling over and stuff like that. And so I like people to be, at least for the first 2 to 3 days, have somebody staying with them to help them get around without falling and safely. Usually after that, then you've kind of gotten the transfers in and out of bed down a little bit, and you're a little more comfortable on your own feet. It's really important to walk after all of these operations to prevent blood clots. We're tightening things up so that blood flow has got to go, against gravity up your legs and back to the heart. And we've just caused a major roadblock for it by tightening everything up, on its way. And so the way that you get that blood is the muscles of your legs kind of squeezing it upwards. And so that's what prevents blood clots. So we need you walking around, but I want you to be safe about it. And so that's where help is really, really important.
Well, compression, I know is a piece of it too.
Mhm.
And that comes with the recovery because a lot of people, if it's arms, like, do you still have to wear a compression garment on your arms and your
Mhm.
stomach and your thighs? And how long
Yeah.
does someone have to wear that?
I like to keep them in compression for 6 weeks. Usually after surgery, for let's say for a tummy, we have this big kind of hefty garment that's really uncomfortable. At your 1 week visit, we switch it out for something that's a little lower profile that you can wear into your clothes. It's more like Spanx. And I like you to be in compression for at least 6 weeks. Same goes for the arms and thighs. There's just different garments. You have compression sleeves instead of,
Mhm,
a binder like on the
mhm,
belly. Compression is really important. It helps keep the swelling down. It's good for your scars. Compression along the scars is really good for healing. Um, we also have tape along the scars. The tape stays for 6 weeks, just like the compression. And so 6 weeks is usually that magic number where all the things from surgery, whether it's tape, compression, lifting restrictions, 6 weeks is that number where we're like, okay, let's lift these restrictions.
mhm,
Now, even beyond 6 weeks, some people just like their compression. They say it's more
mhm,
comfortable for them. I have no problem with you continuing to wear compression. Swelling after these surgeries does not go away totally for up to
mhm,
6 months or beyond sometimes. And so,
mhm,
to the extent that you're okay wearing it, I'm fine if you wear compression as long as you want. But
mhm.
I only usually require it for up to that 6 week period. It's a good
Got it.
question.
Yeah.
The arm garments, I had a recent arm liposuction patient who's a close friend of the family actually, and she the arm garment kind of went around her back and on her arms, and it was open in the front, and so it looked really odd. She said she had kind of like Madonna breasts, like
Oh, yes.
conified like ice
Yeah.
cream cones.
Yeah.
And so she found her own other one on Amazon that she likes a
Yeah.
lot better. And so the other thing with compression is just because we give you a garment doesn't mean that's the one that you have to use. I'm fine if you have something more comfortable that you prefer, as long as it's giving you that good compression.
Mhm. Oh, that's so good. It's also why
Yeah.
people timing this, especially arms, you might not want to do it during the summer, or maybe you
Hmm.
do, or I'm glad we're providing this info. Okay, I have
Yeah.
two more. I've tried to group together all the questions we got into kind of
Oh
topics.
yeah.
I mean, I could just start with belly buttons, which is
Yeah.
most of the questions. So I want to talk about that.
Yeah.
But also same with like, because this is the topic that came up, especially around my sister doing hers. Well, wait, you haven't had children yet. And I
Mm,
think that's what I hear a lot because now these women in their, teens and 20s and even early 30s,
mhm,
maybe they're going to start a family, maybe they're not. But at that
mhm,
moment, my sister was 21 and was like,
mhm,
I don't want to date like this.
mhm.
And I'm so glad she did it, but people were
Yeah.
not like, why would you do that before having kids? And I think that's such a funny part of it. But I get it with tummy tucks. This is a lot
Yeah.
of money. So yeah, belly
Yeah. I mean,
buttons, everyone's terrified.
yeah. Belly
They want
buttons.
to know what they can do. They're worried about it being off center.
Yeah.
They think you're going to cut it off
Hmm.
and put it back on somehow. Can
Hmm.
you
I
give
know
us a
that's
little belly button?
that belly. Let's talk belly buttons. That's one of the most common misconceptions. That and nipples. People
Yes.
think that you cut them off
Yep.
and then just like put them back on. That's not how
Yeah.
you do either of those things. The belly
Yeah.
button is no exception. Belly button is a remnant of your umbilical cord, and so when we make a cut around it, but we don't remove it from your body. When we cut around it and we remove all the tissue from directly around the belly button, it's literally like a little umbilical cord still in there. That's what it looks like. It's like a
Mhm.
little stalk with belly button skin on there. And all
Mhm.
the blood flow to it comes from the abdominal wall. And so as long as you're not cutting, too close to that umbilical cord like stalk, your belly button is gonna, it's your same belly button, the same skin of the belly button. We just cut it out. And then when we pull the skin over it, we have to make a new home for it. We make a new hole in the skin and pull it up through. So it's your same belly button that you've always had in the same place it's always been. And that's an important thing because to your point about it being off midline, a lot of people don't realize that a lot of belly buttons are not perfectly in the midline,
Mhm.
especially in people that have gained a lot of weight and then lost that weight. A lot of times when you gain that weight, that belly button has just like everything else kind of stretched. And then when you lose that weight, it kind of is now off center.
Mhm.
And so there's some tricks we can do in surgery to try and centralize it. But for the most part, what we're doing in surgery is leaving your belly button exactly where it already is. And if your belly button's in the middle of your body, it's going to be in the middle of your body, midline, with just a new incision around it. So I don't think belly buttons is the telltale sign of a tummy tuck. One of the things that attracted, before I was even employed by Amelia, I called up Dr. Pyle and was like, "What are you guys doing with your belly buttons? They look so good." And he told me. And then, when I started working here, I spent a lot of time in Raleigh. I got to see him how he does his belly buttons. I would say, and all the Amelia surgeons virtually do them in the same way, maybe a slight variability here and there, but essentially it's all the same. Principally, it's the same belly button. And so I would put our belly buttons up against anybody. They turn out really good, really natural. If you don't want it to be too big, you also don't want it to be too small. You don't want it to be too wide, but you don't want it to be too, skinny, like a coin slot. Nobody wants that either. And so, so I would say to the people that are nervous, rightfully so, there's plenty of bad belly buttons out there, but look at your surgeons before and after. One of the best things that I've done was do the tummy tuck for my patient care coordinator. So, as a newer surgeon, you don't have that volume of before and afters. The best thing you could do is have your people, show off for you. So when I see tummy tuck patients and they want to see what a belly button of mine looks like, their next stop is my patient care coordinator, who has a belly button of mine, and she's very happy with it. It's in the middle, and so I would say look at your surgeons before and afters, talk to them about the belly button, let them know your concerns. But there's no way a belly button that's slightly off center looks worse essentially than the reason you're getting the tummy tuck in the first place. Does that make sense? Like, you can sacrifice, even if it is just tiny off a little bit here or there. No surgeon is perfect, right? If you carry the, if you're looking at millimeters from one side of the body to the other, almost everybody's is going to be off to some extent. So we're perfectionists too. But you have to kind of accept a little bit that there could be asymmetries, but also know that your surgeon we spend a lot of time on belly buttons. We dream about belly buttons. It's like the most important part of the tummy tuck. So we take it very seriously.
Yeah, we could do a whole topic on realistic expectations too.
That's true too.
I do think Bustmob ladies are different, educating ourselves and having realistic expectations. But yeah, if I picked apart my tummy tuck, I could find tiny things here or there.
Right. Exactly.
I'm over the moon. There's no such thing as a magic wand that would have just given me someone else's everything. But man, I could have made myself miserable, but I chose to not, and I'm very happy with mine. Talk to me about the kids or no kids. Like, how do you have that conversation when you're meeting with someone who might be 25 and has lost 100 pounds?
Listen, I'm not a proponent of like just putting things off just because of maybes. There are surgeons out there that say, I want to make sure you're not going to have kids after a tummy tuck, because yes, if you have a tummy tuck and then you have children, there's a possibility you would need some sort of additional procedure afterwards to correct the stretching. Just like before you have the tummy tuck, the muscles can get stretched out again. You may need them retightened. The skin could get stretched. You may need more skin off. And so as long as your surgeon's upfront and honest that these things could happen if you get pregnant and you're okay with it, there's no reason not to do it when you're ready for it. Why, the way I look at it is, if you are unhappy with your hair color, right, you go to the hairdresser and you get your hair changed. If you don't like your teeth are crooked, you go to the dentist and you get Invisalign and you straighten them. Like, there's things we don't like about our bodies and ourselves all the time, and it just makes us feel better. So why wait for this hypothetical scenario in the future to dictate what you're going to do now that helps your confidence, your happiness, or your self-esteem, and those kind of things? And so I don't like the idea of saying, hey, you better not have any kids after a tummy tuck, because that's, if you meet the right person, you're ready to have a family, like, you can have kids. It's not dangerous for the baby. It could affect your tummy tuck result. We got to be upfront and honest about that. But anything that can happen is also fixable again if it's something that bothers you down the road. And so,
Yeah.
yeah, I don't like I don't like the idea that there's all these prerequisites to having surgery. I think in a woman's mind or even a man's mind, if the time is right for them, then the time is right. You don't have to wait for any reason.
Mhm. Yay. Amen to
Unless you haven't
that.
lost your weight yet.
You did that. You did that
Yeah,
well.
yeah.
No, that was good. Thank you. I know we could go on and on and
Hmm.
on about all of these different body parts because
Yeah.
weight affects so much.
Hmm.
But I think that was a really good, hopefully high level overview.
Yeah.
If anybody wants to ask Dr. Azzolini other questions, definitely follow him on Instagram. I know you're on TikTok. It's
Yeah.
dr.azzolini.amelia.
Yep.
Um, and they can DM you questions too and go ahead and
Absolutely.
follow along. Love me some Wilmington, North Carolina. So if anybody wants to
Oh,
go to
yeah.
Surgeon at the Beach too, here's
Yeah.
a good one for you.
Yeah. If you haven't been here, it's such a cute town. Relatively unknown. I didn't really even know about it until, I met you guys and flew out here. And I absolutely love Wilmington. It's a beautiful little cozy coastal town that
Yeah,
is booming in growth. And so
I know.
it's a
We
lot
need
of
to
fun
stop
living
people from going down
here.
there
Yeah.
at the same time. We
Yeah.
need
I
to
take it
stop
back. I
selling
take
it.
it back.
Yeah, it's terrible.
It's terrible.
Thank you. We'll
Yeah.
talk to you soon.
Thank you, Greta. Bye.